Good afternoon, Mohammed.
Good afternoon, Devendra.
As head of the International Federation in New Delhi, can you tell us about the work of the International Federation in India?
The work of International Federation in India started earlier, before Gujarat earthquake, specifically for India office. It has been established to assist India Red Cross and to help in its response to the major earthquake disaster which took place in January 2001, and assist the most affected and vulnerable people, which tend to be a long-term program and support, being a member of the International Federation, which now constitutes of 186 national societies, and India Red Cross, one of the great members, having about 12 million volunteers and members and 700 branches network. And the Federation is supporting in various programs and aspects, that is capacity building for the national society in terms of organization and branch development, health and care, including HIV, AIDS awareness, including Red Cross Volunteers Network, and public health and emergency, disaster management and preparedness. And since 2001, India office has been established, initially as an operation center, with the support of a regional office which has been existing before.
India and South Asia are challenged by many disasters year after year. So what is the International Federation and the Red Cross, Red Crescent doing in South Asia and in India to prevent a large impact from these disasters?
Actually, we start and focus on community-based risk reduction activities, which India Red Cross has initiated that in various states. I would say 11 disaster-prone states has been targeted by India Red Cross with the support of the Federation, whether through the country-based office or through the regional regional delegation disaster management team, to assist in community-based disaster risk reduction, mitigation activities like building race platforms, mitigation activities in terms of providing water purification units, in terms of quick disaster response. First team to be established for disaster, national team to be established in disaster response, it was India in 2003. Renovation of warehouses, pre-position of essential non-food items to speed up the response in case of disaster. As you know, India also prone to various types of disasters, earthquakes, droughts, floods, cyclones, and recently tsunami, and many other types of disasters. So Federation is really supporting and working closely with India Red Cross to increase such capacity of India Red Cross to be well prepared to serve the most vulnerable people.
Mohammed, can you tell us about some of the challenges that the Red Cross, Red Crescent, which also includes the Indian Red Cross, face in terms of providing relief during times of disaster, and to also augment the health services in the country?
Okay, I think Red Cross, and whether the Indian Red Cross or even the Federation, it's not only the humanitarian organization who provide relief assistance. Definitely there are others, and for that there is some sort of, I would not say competition, but you need to be well prepared to respond fast and effectively to the needs of the most vulnerable people. Therefore, coordination is one of the challenges with various stakeholders. Then access to the affected areas sometimes is be a challenging factor actually to reach the most isolated or marooned, and we have several cases in such situation like Bihar or Assam, when many areas or many districts were flooded in the past. So it was really a great challenge, and you may not have that means to reach the people immediately, but definitely it's going to be complemented by the national and local authorities to reach the most affected people.
Mohammed, can you tell us a bit about the awareness of the Red Cross and also of its emblem in India?
Actually, Red Cross emblem and the awareness about Red Cross, India Red Cross is taking a lead in this process, and through its network of volunteers, trying to disseminate that Red Cross emblem should be only used for Red Cross premises and personnel, which has also protective purposes, which also should be very clearly and specifically used by Red Cross operation and for Red Cross purposes. Like often we see in the hospitals and pharmacies, and people really use the Red Cross, which shouldn't be. They should their what we call it internationally agreed symbols and emblems, and leave Red Cross for the Red Cross society work and operation.
Mohamed, lastly, we would like to know what are the new initiatives of the Federation and also of the Indian Red Cross in India?
There is many initiatives in various fields, like in health. HIV is a big concern. India Red Cross, with the support of Federation, established a consortium of India Consortium for HIV, and with few members in the beginning, which now expanding, to include many Red Cross and Red Crescent, Red Cross members, and even geographically, in terms of expansion from 15 districts now it become to 1 districts. In terms of resources and funds, it's also scaling up. And other initiatives, this integrated program approach, where collectively all programs are putting resources together to support and strengthen India Red Cross structure and capacity to serve the people better, like health, disaster management, and organization and humanitarian values all come together, and then jointly addressing these various issues with financial resources, human resources, and material resources put together through public health in emergency, which is a new initiative I think need to be expanded, and also risk reduction activities at various diversified. Okay, for cyclone it's completely different approach, while for floods also another approach, with the community being the main focus and with their participation.
Thank you, Mohamed, and all the best for your work in India.
Thank you very much, Devendra, for your support, and welcome.